I'm Dr. Fritz Allen, and I am in practicing ophthalmology for the past 25 years, and I am full-time in the office to visionary ophthalmology, and I take care of one special niche of eye diseases in the office. I do mainly medical retina, taking care of diabetic retinopathy, and also some plastic surgery, taking care of blepharoplasties, ptosis, which is the drooping of the eyelid, and brow ptosis, and also I do cataract surgery, of course. Talking about diabetic retinopathy, this is one of the leading causes of blindness in the United States in the working age of American. It's more common in African American and even more common on Latinos and people with Indian descent. I'm talking about Native American. Diabetes is more common in that population, and of course the side effect in the eye is also more common at the end, because the side effect in the eye happen in non-treated or diabetes that is not fully controlled. One of the main reasons why people lose their vision in diabetes is because the diabetes long-term, with the high level of blood sugar combined with high blood pressure and cholesterol level, will destroy the small tiny blood vessels in the body, including the small blood vessels in the eye, the kidneys, the toes, and everywhere else. But the beauty about the eye is the only place in your body where we can see blood vessels live. And that gives us an advantage over the other specialty to discover the damage that does diabetes in the human being. And you should check your eyes. If you have a diagnosis of diabetes, you should get an eye exam every year, even if everything is well controlled, because looking in the back of the eye, we can see a sample, as I said before, of your blood vessels live, and that give us an indication how the diabetes is doing in general. If we see some signs of early damage on the small blood vessels in the back of the eye, it tells us that your diabetes is not well controlled. And what we do in the office is not only a full eye exam, we dilate your pupil, take a look in the back of the eye, but we also have the technology in looking. We do some scanning of the retina that can see the thickness of your retina, and that can give us an indication if there is any leakage of any blood vessels. Doing the treatment for diabetic retinopathy reduce your risk of going blind by 50%, which is without treatment is almost 100% you're going to go blind. When I say 100%, probably not, but on the whole population, probably about 60% of the population on diabetes, which is not under control at all, will end up going blind. It takes years for that to happen, but if we do the treatment, we reduce that number by 40%. And we cannot reduce the number by more because the main line of treatment is controlling the diabetes. If we do the treatment and the diabetes is not well controlled, you end up losing your vision anyway. But if we can control the diabetes, control the blood sugar, control your blood pressure and cholesterol level, we can at the same time has a basically significant benefit in preventing vision loss in a short period of time, and even long term prevent the vision loss.